No joke, I've sent over 10 of my friends to my therapist because so many people come to me telling me that they have a hard time getting started. So I wanted to put together a no bullshit guide on how to get into therapy. I know when I first started, I struggled to find the right therapist, and I almost felt like I needed a therapist to find a therapist because the process was so confusing. I was overwhelmed by all the information out there and had a lot of uncertainty about if I was making the right choice. So let's get started. First off, if you're super anti-therapy, that's totally fine. You do you. This video might not be for you. But I'm speaking to people who might be feeling a little bit resistant, scared, or uncomfortable with the idea of therapy, but they know that they probably need it. A big blocker for people is just straight up the cost. Therapy can be expensive, especially if you're underinsured or uninsured. The cost of therapy can be unmanageable, and I totally get that. But later in the video, I'll show you some alternatives if cost is a barrier for you. Another big one is fear. What if therapy shows that there's something wrong with you? What if you start unpacking things and you realize that there's some inner demons that you are not ready to deal with? And a lot of people have had significant trauma or hardships in their past. The idea of having to relive those experiences and face them in therapy is freaking scary. A related issue is the fear of judgment from your peers or your family. I know therapy has come a long way in being socially accepted, but honestly, people still worry about other people judging them for having problems. And in certain cultures, it's still taboo and looked down upon. Even for me, my parents gave me the side eye when I told them I first wanted to get into therapy. Another common one that I hear is that someone might have had a bad therapist in the past, and because of that experience, they kind of think therapy is unsafe or not for them. Some people also feel like there's just not enough time, right? They feel like they have so many other commitments and therapy's just at the bottom of the list and they can keep kicking the can down the road. Basically, procrastination. I don't have enough time, I'll get to it one day, etc., etc. There's also a matter of identity. I think many of us identify as someone who is independent and have their shit together, and it's hard for us to raise our hand and say, hey, I need some help, or that I have some blind spots or limiting beliefs that I want to work on. People have also told me that they struggle with knowing how they feel and putting words or even labeling how they're feeling. Maybe it's because of their upbringing and they were told to kind of hide their feelings, told not to cry or show too much emotion. So when it comes to therapy and in those sessions, they actually don't know what to talk about. There's almost like a disconnect between their head and their heart. It's like a language that they're not used to using. So for those folks, I gathered a list of topics and questions that can kind of get you jump started so that you don't feel like you're just sitting there staring at the therapist having nothing to talk about. And then we have the folks that think that therapy is useless and ineffective and can't fix them. I've actually been told that they think therapists are incentivized not to fix you because then if you're ready to graduate, you'll stop paying them and stop going. You know what else is also very confusing? All the levels of mental health professionals out there, different titles, different acronyms. It's a lot. So I'll just go over the basic ones to kind of get you started, but just know that you might see slightly different ones out in the wild. So one of the most common groups that you're going to see are LMFTs, which stands for Licensed Marriage and Family Therapists. They focus a lot on interpersonal relationships. A lot of the topics that come up have to do with relationship with yourself, relationship with your siblings, family, parents, romantic partners, etc. Focusing a lot on the dynamics that you have with the people in your life. Another common one you'll see are LCSWs, which stands for Licensed Clinical Social Workers. So they also do individual therapy, but they have more of a systemic or societal lens. So it might be best for individuals who are facing issues more on the systemic level and need resources on how to navigate larger societal structures. Then you have psychologists, which are doctors that have a PhD or PsyD and are able to do more in-depth psychological assessments and testing for individuals that have maybe more complicated cases. If there's any indication that there might be a mental health disorder, you would go to a psychologist to get the proper diagnosis. Then you have psychiatrists that are also doctors, but they're usually MDs or DOs. And so that means that they can actually prescribe medication for the more severe mental health disorders or issues. So what therapist is right for you? Finding a therapist is kind of like dating. It all depends on your needs, your goals, your own personal situation, and where you are right now. Here are my tips on how to choose the right therapist for you. Have a plan plan of what you want to get out of therapy and what you want to focus on. There's mental health professionals that focus on a plethora of different topics. Some might specialize in depression or couples therapy, or maybe discussing race or gender issues, even dealing with addiction or eating disorders. If you have a sense of what you want to work on, it definitely helps narrow down the specialist that you want to talk to. The reason you want to be very specific is because finding a therapist is so much about finding the right fit. Not only do you want to make sure that they have the experience to deal with the topics that you want to cover, but you also want to feel super comfortable with them, that you can really be yourself in the safe space that they create alongside you. For me, when I first started therapy, I really wanted to unpack my feelings as an Asian female and having this pressure of hitting the milestones that I thought I would by that time in my life. So I booked over 10 plus different intro sessions with therapists from different ethnic backgrounds, age groups, genders, in hopes to figure out what would be best for me. In that process, I realized I felt most comfortable and most myself when I was speaking with an Asian female that was probably a little further along in their journey. They already understood the cultural context and background that I was coming from. They got the immigrant story and they understood what filial piety meant to me and all the pressures of being not only a woman, but a woman of color in America. There was so many unspoken things that I did not have to explain. And for me, that was really essential to feel like I could be fully present and fully myself in those sessions. You will definitely have way different criteria than me. And what makes you feel comfortable and heard and fully seen is not the same as it is for me. But what I want to emphasize to you is that don't settle. Like in dating, do not settle for the first therapist that you go see. If it doesn't feel right, it doesn't feel right. This is someone that you're going to see on an ongoing basis. So trust your instincts and make sure that you vibe with them. Another thing that gets often overlooked is how high is the barrier to get help? Meaning, what is the friction when it comes to booking an appointment? It sounds simple, but some therapists require you to call to book an appointment or email a bunch back and forth, or their appointments are always only certain hours that you're already working and you can't take them. I had a friend that his therapist made it so hard for him to book an appointment because he needed to call and text or whatever, that when he was actually having a crisis, that therapist was not available for another 2 weeks. That might not seem like a big deal, but when you actually need help, you want as little barriers in front of you as possible in getting it. So my personal preference is I like it when therapist has like an online booking calendar that I can find my slots in ahead of time without doing this whole dance to get an appointment on the calendar. So many of these sessions are happening online and it's made things a lot easier and more accessible. But if you're someone that really needs the in-person session, maybe it's best to find someone that can maybe do both. You could show up in person if it's close to your work, or you could do some online as it best fits your schedule. The point is, make it easier on yourself so that it actually happens and you don't just procrastinate it because time just seems to run away from us. I also want to emphasize that the worst time I feel like it is to find a therapist is when you're actually in a crisis and you really need a therapist, because it's so difficult. It's like you have to kiss a lot of frogs to find the one that actually matches. So if you're even a little bit interested, I would recommend that you kind of do your shopping and try to find the best fit when things are relatively calm. It could take weeks or even months to find the right person, and you just don't want to be dealing with that when you're already feeling unstable. A good example of this is, you know how some couples seek out couples therapy when things are super dire, they're about to break up and it's like the last ditch effort. But if they had started therapy, let's say 6 months prior, and they were able to ease into it, turn down the dial and solve things when things were less heightened and stressed out, that's what I mean. You want to do maintenance or tune-ups on yourself and your relationships before everything falls apart. One of my biggest pet peeves and something that I look out for is a therapist that's kind of a yes man or yes woman. I could be pouring my heart out to them, but I feel like they aren't really actively listening. You kind of feel like you're talking to a wall almost. Maybe they ask you similar questions. Everything seems like it's going off a checklist and they're not really engaging and fully present with you. I personally like it when they take good notes about our conversation so that later on, if they notice certain patterns that I'm doing, certain excuses that I'm giving myself, certain bad habits that I have, they are kind of a form of accountability. They can notice those trends that I might not notice and call it out. That to me is a good sign of a therapist that I want on my team. I think therapy is something that I want to have a lot of growth in, and in order to have growth, You need to have somebody who really is willing to roll up their sleeves and shine light on your blind spots. This next one is very specific to your own personal situation and financial ability. I understand that therapy is known to be expensive, but don't count yourself out. There are so many different payment options out there. There's sliding scale, there's free options, etc. I had a girlfriend who thought that she couldn't afford therapy because she had to pay over $100+ per session, even though she had insurance. But I taught her how to find the therapist that would actually take her insurance, and now she only pays $15 copay. So the information is out there, but it is opaque and confusing. I want to make sure that you leave no stone unturned to find the resources that can help you. So real quick on the cost of therapy. Like all things in life, it can vary greatly. It depends on the type of therapist you choose and their level of experience, the length of the session, and sometimes the frequency of how often you have these sessions. To give you a general idea, in the US, the cost per session varies from, let's say, $100 to $500+ before insurance kicks in. So most providers take insurance, and so the client is only responsible for the copay. I've seen people pay $15 for copay or $50 for copay. And some common insurance are obviously Anthem, Blue Shield, Kaiser Permanente, etc. If the provider doesn't take insurance or the client doesn't have insurance, then they would have to pay out of pocket or private pay. That's where it gets expensive. Some employees work at companies that give them access to HSAs or FSAs, which is health savings accounts or flexible spending accounts. That money is pre-tax money that can also be used to pay for therapy. This is obviously hard to come by, but there may be opportunities for free therapy sessions if you know where to look. Interns that are trying to complete their studies to become mental health professionals might be able to do some sessions for free. There's also some state programs or crisis hotlines that have limited handful of sessions available for those who qualify. You'll also see some therapists that advertise that they have sliding scale when it comes to their fees. So they'll take into consideration your personal situation and income levels in determining the fee that they're going to charge you. I've seen sessions that are normally $150 an hour lowered to about $70 per session to accommodate clients. Now it's the hard part. How do you find that therapist that has experience dealing with a situation that you're in, that fits your budget, and that you can actually get on their calendar? I literally tried all of these methods, so I'm going to break it down for you so you know what's kind of the old school way of doing things and what I would recommend today. I feel like when everyone starts Googling therapy, they'll come across this website called Psychology Today, and it's this directory of all these different therapists in every state. The problem with this is that a lot of the information is dated, and you have to do all this extra work to contact them. You have to call them, email them, chase them down, and sometimes they just tell you that they're fully booked and they don't have room for new patients. Some states also have state directories, and that's also kind of finding a needle in the haystack. Plenty of outdated information that you have to sift through. Another option that a lot of people try is going through their insurance website. So you think, okay, I go to my insurance, of course they're going to have the most up-to-date directory of therapists. But you'll find that a lot of insurance websites and apps are kind of clunky when you're trying to search for therapists or any medical professional, and they don't really have a ton of reviews. It's just a really subpar search experience. They also don't do a really good job of showing who is available to take on new patients. The next group are startups like BetterHelp and Talkspace. And I kind of have a hot take here where I don't really love these platforms. I know they advertise a ton on YouTube and other social media, but BetterHelp actually got in trouble and had to settle for about $8 million with the FTC because they were not keeping customers' sensitive information private. The reason I don't love these, other than that, which is already really bad, is because you're paying a third party in the middle. You're paying the fee to the entity, to that company. I get that you have multiple forms of communication. You get text, you get, video and messages with your therapist, but I always found that a lot of the best therapists don't actually opt for that kind of structure. They rather work directly with the client. So when you kind of go with these middlemen, you run the risk of getting therapists that maybe are still building their book of business or for whatever reason are not getting the clientele directly. And that direct relationship, I think, really matters when it comes to privacy and honestly quality. Now, here are the resources that I share with my friends and family: Alma and Headway. I kind of lumped them together because they're quite similar, but what I really appreciate about them is the user experience and interface. They allow you to filter. I can choose by state, insurance, if I want in-person or virtual only, what type of topics do I want to talk about? Are they qualified to prescribe medication? What gender, ethnicity, or sexual orientation that therapist is? All that to hone in the perfect fit. Another thing that I appreciate so much is that a lot of the providers actually have their availabilities listed on the website. They literally tell you when their next available appointment is, and most of them allow you to book it right then and there. So no more song and dance and sending paper airplanes to get on someone's calendar. You can actually book multiple intro sessions within the span of, let's say, 2 weeks, and you can get a good read on what feels right for you. The best part of this is how easy the payment side of things are. Because you're already pre-selecting therapists that take your insurance, when it comes to actually paying for your sessions, you can have your insurance information already saved, so that entire checkout process is a lot easier, and all you have to pay for is your copay. I will say that there's another company that has a similar setup. It used to be called Path, and now they rebranded as Rula. I personally have not tried them before, but their website seems like it's pretty easy to use and also allows you to filter for the right person. Here are some common questions that I get asked about. How do you prepare for therapy, and what is there to talk about? You can just show up, be present, and engage with your therapist, and it should flow naturally. I put together some topics and questions to get you started. I've also linked them in the blog below. Something that you might want to try is that after your sessions, jot down a few notes on what you talked about and things that you want to implement that week before your next session. This therapy journal is a really great way to track your progress and reflect on what you're learning. How often should I go to therapy? This is definitely based on your unique situation, and you and your therapist will come up with the right cadence that works for you. I have friends that go twice a week. I have friends that go once every 2 weeks or once a month. I think a lot of times it starts off at once per week, and you kind of dial it up and down as you go. Clearly, this is a topic that I feel very passionate about, and it's actually a big reason why I started my business. I really wanted the accountability, the self-awareness, a safe space so I could be vulnerable about my life. One thing I realized that I couldn't solve solely through therapy and just talking about my emotions was the financial aspects of my life. And so that is why I created Doing Well. There still had to be step number one. How could I get myself out of the scarcity mindset when it comes to money and take concrete actions that get me closer to having financial peace of mind? I wanted to create something that would give myself and others a strong personal finance foundation so that we can live our lives more fully. When people ask you, how are you doing? You can say you're doing well and actually mean it. If you're interested in having a free 1-hour counseling session, you can book directly at doingwell.io.